Hi everyone, my name is Michael Wong. I'm a second year administration resident here at UW Medicine. Today I'm going to show you about our inpatient pharmacy. Let's grab the door, let's go. So, welcome to our inpatient pharmacy. This area is our medication reconciliation technicians area. We can see like some hello here. So our pharmacy technician collect medication lists from the patients, what they're taking at home, and input it into our computer system to make sure that we know what medication patient is taking, and we can the providers team can restart it accordingly. Our pharmacy, there is this like narcotic storage area, which is like an additional door before you can go into there. So we store our controlled substance in there to making sure that we are having an accurate count and also protect them in a more controlled area to get a tight inventory. So you can take a look at this. When we dispense it, we need to, whenever we grab it out of the shelf, we need to go ahead and document it in the computer. So here is our pharmacy dispensing area. Our pharmacy technician and intern will fill up the medication for patients. So by selecting the task, we'll get a pharmacy label, and this label will indicate what medication the patient should be on. And by scanning the medication label, we're able to identify where the location of the medication is, and then we'll come over here, and then we'll be backing it up and giving this product directly to our pharmacist in the front to verify the orders. Welcome to our IV room. So here is where we prepare all our injectable products for intravenous or any other different form that we want to prepare the products in a more controlled and sterile environment. So let's take a look and go inside. This room has a very tight control in terms of like pressure inside the room, and also we want to maintain it as clean as possible. You can see that here is the line of demarcation. We cannot cross the line unless we dress up with our protective gears, and that way we can make sure that the product we send up to the floor for our patient is like sterile. So make sure that there's no infection or any other complication caused by the product we make. So you can take a look inside. You can see we have a buffer room here and we have an empty room, so which means that we have two different conditions to make sure that we have a clean environment for our patient's medication. And you can also see the hoods, IV hoods in there, so they're in a specific condition to make sure that our products maintain the sterility. And we can see some of our technician is compounding the IV inside the hood right now. Another very important function for our pharmacist here and pharmacy technician is maintaining the medication supplied for our patient, making sure that there's no shortage of certain items, and when shortage happens, making sure we have alternatives for them. So we have a pharmacy purchasing team to make sure that we have all these products here ready when we need it. So it's there every day when they receive a shipment from our manufacturer or from our distributor, they will be putting it in an assigned location just to make sure that we can find it when we need it. And you can see it's a lot of heavy medication and big supply. So this is our packaging machine. It's definitely a best friend for our pharmacy. So in the outpatient side, we can give a whole bottle of medication for our patient. But imagine that if we're dispensing one of these big bottles and then the patient is only staying with us for 1 or 2 days. So instead of like giving them the whole bottle, our technician package them into individual items and then dispense it every day. And also because in the inpatient side, in the hospital, patient is usually having changes every day. So by packaging it and dispensing it as a unit dose, which means 1 tablet at a time, it's better for us to control what medication the patient is taking every single day. So here's our main work area for our pharmacists. So our pharmacists will be verifying medication orders here. So the way it works like this. So the provider will order a medication to send to our pharmacy for the patients. And then our pharmacists will be verifying the dose, the routes, and then all the details about that specific medication orders. And if there's any questions, they will be reaching out to our clinical pharmacists on the floor or reaching out to the providers to clarify the order to make sure that the patient receiving the safest and also the most appropriate therapy. In our main work area, we have a second pharmacist here to verify the accuracy of the orders that we fill. So here is one of the examples that we make the medication, fill it, and bring it to our pharmacist and check it accordingly to what is inside the product and what is inside the bag and also what is on the labels. And after this is done, we will be coming over to our pneumatic tube station. For any orders that we need to get to our nurses and get to our patient right away, we have this system here. It's called the pneumatic tube system. And we can see our intern is currently tubing the medication directly connect to the floor. So, and this way we can save a lot of time running the medication around or any delay that will cause for bringing the medication on the floor by delivery.
Welcome to our oncology pharmacy. This pharmacy is where we store and prepare our hazardous medications for both patients receiving chemotherapy in the hospital and those coming into our clinics to receive chemotherapy. In order to prepare those medications, we have to have them stored and prepared under a negative pressure environment. So here in our oncology satellite, you can see over here, this is kind of a window into our negative pressure environment. As you peer through our pass-through, you can see slightly off to the right where we have some drug storage. So all of our sterile hazardous medications are stored in that manner. And then off to the left, you can see a biological safety cabinet where we prepare our sterile hazardous medications. If you look over here at our pharmacist, she's able to see, if you could pull up a picture please. She's able to see what medications the technician has prepared by utilizing camera technology. So utilizing the photographs that the technician is taking through the drug preparation process, she's able to see exactly what was pulled up, from what vial, what the dating of that vial was, and what the technician then added to that final product. So we have a very good record of what is happening in real time through the admixture process. Once it's prepared, then it is set here in the pass-through for dispensing to our patient care areas. Over here, we have also another small closet where we have negative pressure, non-sterile storage. So the drugs in here are hazardous medications, but they're not sterile. So this room is actually a negative pressure environment and is externally vented outside the hospital. If we step over here, you can see the entrance into our negative pressure environment, and I'll open the door here for Derek in a moment so you can kind of peer in. But we have a very formal procedure that gets our staff member properly protected from the hazardous drugs. So they have PPE that they have to wear, and there's a particular order in which they have to put that on. We are able to measure that negative pressure environment and what's happening through the use of these gauges, and they are essentially monitored for notification if anything is out of range. So I'll open it up, and then Derek, perhaps you can kind of stare down the buffer room of the negative pressure environment. Without crossing the red line. Yes, thank you. And if there's any medications that we need to give to our infusion area, which is an outpatient area, we actually have a pass-through here that that we can set the medications in for the nurse to pick up and administer to the patient. And that's our oncology pharmacy. Bye.
My name is Derek. I'm a PGY2 admin resident here with Michael. wanted to show you guys one of our medication rooms. So we're actually on the 6th floor of our hospital right now. This is where a lot of our general medicine and cardiology patients will stay. Right now I was going to show you our Pyxis machine. So this is, I like to think of it as our candy machine for drugs here in the hospital. We like to carry a lot of our medications that our patients will use on the floor here in the Pyxis machine. I want to show you a few quick functionality tools that we have. So one thing is, we showed you the inpatient pharmacy earlier. A lot of our technicians will pull drugs for our Pyxis refills. So on our hourly deliveries, they'll come up here and they can use the refill function to be able to fill the Pyxis and make sure that we can distribute drugs to our patients. Okay, so I want to show you guys a few quick functionality tools of the Pyxis machine. So one thing Michael just did was he logged in, because this is really important that it's secure and we know exactly who's accessing the Pyxis machine. So there's actually, you have to use your fingerprint to log in, as well as your unique login information. A few different things that we use the Pyxis machine for. One of the things is there's a refill functionality to it. So our technicians down in the basement, they when they're filling things on the carousel and picking medications, after the pharmacist checks them, they'll come up here and we can refill the Pyxis machine. Now I'm going to show you guys what one of these pockets actually looks like. So I'll show you what the Tylenol looks like. So I click on the drug, I type inventory selection here, and I go to pocket 21 like it tells me to in drawer 1. So this is drawer 1, go to pocket 21, and this is where our Tylenol are. And then Michael and I already, before we started the video, counted them out, and we saw that there is 150, so I won't bore you to death on that. So we confirm that there's 150 in there, we hit accept, and it's good to go. If we were actually refilling a medication, we would click this button, and it would prompt the technician to go to the drawer that the pill resides in, and they would refill it. Okay, so we're still in the medication room, but there's a few other things. So we showed you the Pyxis machine. There's also a tower for the Pyxis, so these actually house our IV bags. So we saw earlier in the inpatient pharmacy the bags that we have to make from a technician, but these are bags that don't have drugs in them, so they're typically just fluids that we'll keep here by the Pyxis machine, so it's easy access for the nurses. Also in here we have a lot of different medical supplies that the nurses will need. So for example, there's different needles, we have different syringes, there's adapters, you name it, it's probably here if the nurse needs it. So this is a great resource. We have these rooms on all of our floors, and the Pyxis machines are really advantageous to make sure that we're getting our patients the medications as fastly as possible. Alright, so you guys saw our inpatient pharmacy, you saw our satellite, and you saw a medication floor. Now we're going to show you our main outpatient pharmacy here at the University of Washington Montlake campus. So like anything, it's securely accessed, so we have to use our badge to get in. How possible? So welcome, this is the outpatient pharmacy. They have some automation here as well, so we have a Pyxis machine, like you guys saw downstairs. Alright, so this is our Script Pro machine. We have a lot of our drugs that are housed in here in the outpatient pharmacy. As you can see right now, actually it's perfect timing. One of the prescriptions that we're trying to fill is housed in there. So the pills are being counted by the machine. It's spitting out directly into the bottle that it's going to be dispensed in. This one I believe is a atorvastatin, cholesterol medication. And then we'll see here the arm that will take it back over here. It's a little slow here right now. And now it's getting passed. And then the label, watch out, the label was affixed to it. And now it's ready to be checked. Alright, so this is, we talked about the Pyxis machine on the inpatient side. This is the Pyxis that we have here in our outpatient pharmacy. This one's particular to controlled substances though, because it's a C2 safe. So there's certain medications that, like opioids and and other narcotic drugs that we have to house in here for security reasons. So this is a really good system to make sure that we're controlling where our medications are in the outpatient pharmacy. Alright, so the next thing that we're seeing here is our counseling station. So at each dispense, our pharmacist will go up to the counter and talk to the individual patient to go over the medications that they're going home on, many of which may be new based on their hospitalization. So our pharmacists here do a really good job of going over the important counseling points and things that they need to watch for when they go home. Here's our immunization room. So during the flu time, patients can come here and get a flu vaccine, and all of our pharmacists here are able to give those for patients to be able to increase the rates of our community that are getting flu vaccines. And some more facts about the outpatient pharmacy. So on average, they do about 500 scripts a day, so they are a very busy pharmacy. The cool thing about this place, though, is that it mixes pharmacists that work in here normally and then also work in one of our ambulatory care clinics. So they also see patients outside of here. The pharmacists here are really instrumental because they play a big part in transitions of care. So they interact a lot with our providers here, but also the pharmacists that are up on the floors to make sure what's actually prescribed at discharge is appropriate. And they do a lot of chart reviews and look at the medication record to make sure what they were meant to go home on, they're actually going home on.